Hi, I am Dr. Lakshmi, and today we are going to talk about a topic which affects millions of women worldwide: PCOS, polycystic ovarian disease. Right? So, it affects 18% of women worldwide, and let's start by debunking a few myths. The first myth is that only overweight women have PCOS. This is not true. Women of all shapes and sizes can have PCOS. The second is, if you have PCOS, you cannot get pregnant. Although PCOS does affect fertility, it does not stop you from getting pregnant. Many women have successfully become pregnant even with PCOS. You just need the right treatment and management. So now let us talk about PCOS. What is PCOS? Polycystic ovarian disease. Does it mean that there are many cysts on your ovary which is causing all these problems? No. What is actually happening is, for all women, many immature follicles are released during your periods. And then because of some hormonal changes, you get one dominant follicle which then releases the egg. In PCOS or PCOD, what happens is these immature follicles are arrested at that stage. So it looks like you have many cysts, right? So this is PCOS. Now let us talk about the symptoms that you have in PCOS. The first is an anovulatory cycle or irregular cycles. What is the definition of an irregular cycle? If you have lesser than 9 regular periods in a year, extremely heavy bleeding which lasts for 7 to 10 days and which comes very often, or clotting and irregular menstrual cycles, like very heavy bleeding and very often. Okay, so these are irregular menstrual cycles. The next is hair thinning or male pattern baldness. Okay, there is also darkening of skin under your breasts, behind your neck or underarm. Okay, like skin darkening more than usual. In case you notice these things, you can go to your healthcare provider, including skin tags. Usually women come when they have acne and oily skin, because they usually go to the dermatologist, who then asks them to come to the gynecologist to make sure that it's not PCOS, because PCOS is a very common cause of acne and oily skin. Also hair fall and hair growth in places which usually males have hair growth, like facial hair or chest hair or back hair. Okay, so these are the symptoms that people usually come with. Now that they've come with the symptoms, how do you manage it? Medical treatment is always there, but what are the lifestyle choices that you can make to make sure that PCOS is handled a little better? The first is adopt a Mediterranean diet, because it is plant-based, it has good fats, and it also has good grains. So this can improve your hormonal balance in your body, right? And now that you have adopted the Mediterranean diet, you can also have more omega-3 in your diet. What is a good source of omega-3? Salmon fish, herring, or sardines for non-vegetarians. For vegetarians, chia seeds and flax seeds is a good choice. Okay, so now that you are having a Mediterranean diet, omega-3, like rich foods, now what you can do is you can also start exercising, because usually insulin resistance is associated with PCOS. So say you can walk for 1 hour a day, or you can go for a 45-minute walk, that also helps, and do some weight training exercises as well. If you're too busy, you can at least do some exercises at least thrice a week and try to walk every day. Okay, now that you have done this management, and in case your symptoms are still not getting better, your irregular periods, your hair fall, your acne, you should come to a doctor just to get everything seen once, because sometimes symptoms may overlap with, say, thyroid problems, right? Because thyroid people also find that difficulty in losing weight, weight gain, hair fall, acne may sometimes happen in people who have thyroid issues as well. So it is always good to come to a healthcare provider. Thank you for watching this video. Please like and subscribe if you want to watch more health related videos as such. If you have any questions, you can put it down in the comment box below.